What we're gonna do real quick is demonstrate some elbow flossing. I know if you guys have been patients with us before, have come in with a soft tissue injury, whether it's in the upper extremity, lower extremity. If we feel like some of the joints are a little sticky or feel a little restricted and we want to free them up, we use flossing a lot. So we have a couple different sizes we use. You'll see some that are black, some that are red. Our bigger ones we use for the lower extremity are gonna be blue. What's nice about this is it's just like flossing your teeth, except a little bit different for the soft tissue. So what we're gonna do is we're gonna take a horizontal compression. Obviously, with Leachy, you can see biceps run this way, triceps run this way, forearm muscles and that kind of stuff. But we're gonna compress horizontally with this band, and what she's gonna do is she's gonna go through elbow ranges of motion, and what we're gonna do is try to free up some of the restrictions across the joint line. So when you're doing this at home, some of these joints that we're gonna be demonstrating will be needed to have a partner to help you do this. Sometimes you can get away with doing it yourself, but the elbow itself, come on in here a little bit, Mel, so you can see this. All right, so what you need to do first is find your tack strip, okay? So what I've done is I've folded it on itself, that way it stays. And then what you're gonna do is apply about 10 to 20% of stretch, and then you're gonna do a 50% overlay. What I mean by that is you can see I'm overlaying it 50% onto the next one. Okay, and we're gonna go rub it all the way down. And she's probably getting to the point now where she's starting to lose some blood supply to her hand and starting to tingle. And you're good to do this, you're not gonna hurt anything. You could do it for at least a minute, okay? And then leave yourself a little bit so you can come around and fold it underneath, okay? And then what Alicia's gonna do is basically go through the full range of motion of the elbow. And she'll notice, probably after the first 5, it'll get a little easier. You tell me.
I mean, yeah. As much as it can.
As much as it can be. And then she's gonna be able to go a little faster as those tissues become more pliable. And again, kind of watch yourself in a clock, but you can also feel this too. If it gets to the point where you're kind of that claustrophobic feeling, if everything gets real tight, which is going to be, distal from the port where you're going to have it wrapped, which is further away from the body. If it gets to the point where it feels like it's just like getting super numb, then go ahead and unwrap it. But if you can get, a minute and 15 seconds in, and then go a little faster. And if you got sport specific motions of throwing, you can throw that in there too. Maybe a couple more, and that'll be good. All right, so what you'll notice when you unwrap it, she'll get this nice shun of oxygenated blood to feel the areas where we occluded. And you can't really see because this beautiful artwork she's got here, but you should see these lines of where that compression is. That's when you'll know you did it right. Sometimes in the joint creases itself, you may see a little bit of light bruising, but that'll go away in about a day. So that'll be elbow flossing.